3, 2, 1. This is the frontal bone. Orbital socket. Nasal bone. Vomer. Maxilla. Mandible. Zygomatic bone. Condyloid process of the mandible. Angle of the jaw. Mental foramen. Hyoid bone does not make a joint. Attached to C4, the tongue is anchored to it, making it impossible to swallow the tongue. Coronal suture. Sagittal suture. Squamosal suture. Lambdoidal suture. Parietal bones. Temporal bones between my two fingers. This is the sphenoid bone. This is the styloid. This is the external auditory meatus, or external auditory canal. Mastoid process of the temporal bone. This is the occipital bone, also known as the occiput, also known as the basal skull. Where you see the X, that's the bump, that's the occipital protuberance. And then this is the occipital ridge, where you see the green line here, occipital ridge. This is the foramen magnum, the hole in the base of the skull, foramen magnum. Okay? This is the first cervical vertebrae, which is called the atlas. This is the second cervical vertebrae, which is called the axis. You have 7 cervical vertebrae. You have 12 thoracic vertebrae. You have 5 lumbar vertebrae. You have, when you're born, you have 5 sacral vertebrae that fuse together by the time that you're able to sit up and crawl. Then you have 4 coccyx vertebrae that fuse together at the same time that this fuses together. So that's 4 that fuses to 1. These are the spinous processes of the vertebrae. These are the transverse processes of the vertebrae. These are the clavicles. This is the clavicular head. This is the manubrium, or sternal head. This is the jugular notch. This is the sternal angle, where the second rib joins into the sternum. This is the main body of the sternum, also known as the gladiolus. This is the xiphoid process. We have 7 pair of true ribs for a total of 14. We have 5 pair of false ribs for a total of 10, with the 2 bottom pair of ribs, which are unattached to the sternum, are called floating ribs, also are called false ribs, and they're part of the 10. This bone as a whole is called the scapula. This is the spine of the scapula. This is the vertebral border. This is the axillary border. This is the inferior angle of the scapula. This is the superior angle of the scapula. This is the supraspinous fossa. This is the infraspinous fossa. This is the acromion process. This is the glenoid fossa. This is the supraglenoid tubercle. This is the infraglenoid tubercle. And underneath is the subscapular fossa. Subscapular fossa, where you see my fingers disappear back in behind. Okay? This is the head of the humerus. This is the humeral neck. This is the bicipital groove. This is the greater tubercle of the humerus, lesser tubercle of the humerus. This is the deltoid tuberosity. This is the humeral epicondyle. This is the lateral supracondylar ridge. This is the trochlea. This is the coronoid fossa. This is the radial fossa. Okay, on the underside here. This is the olecranon fossa. Nearest the thumb, anatomical position. This is the radius. This is the radial head. This is the radial tuberosity. This is the styloid process of the radius. This is the olecranon process. This is the styloid process of the ulna. These are the carpals. We have a total of 8 carpals in each wrist. Between my hands is the metacarpals, and these are the phalanges. All of your finger bones and toe bones combined are called phalanges, and there are 56 of them. This is the iliac crest. This is the iliac fossa. This is the anterior superior iliac spine. This is the anterior inferior iliac spine. This is the crest of the pubis. And this is the inferior ramus of the pubis, this area right here, inferior ramus of the pubis. This is the pubis symphysis. Okay? These holes in here are the obturator foramen. This is the ilium. These are the ischial spine. The surface that my pen is touching is the ischial tuberosities. Here and here, exactly. Okay. Imagine my hand's a bicycle seat, and when you sit on a bicycle seat, you're sitting on the ischium, just like that. So this is the ischium. Okay. This is the acetabulum. This is the femoral head. Where I'm reaching around with my fingers is the femoral neck or surgical neck of the femur. This is the greater trochanter of the femur. This is the lesser trochanter of the femur. This is the linea aspera on the posterior femur here. It's a sharp edge to it. Linea aspera. This is the medial epicondyle of the femur. This is the lateral epicondyle of the femur. This is the medial condyle of the femur. This is the lateral condyle of the femur. This is the patella. The patella is a sesamoid bone. It's called a sesamoid bone because it is embedded in cartilage and ligamenteous structures, so it basically floats in that cartilage. It's suspended there. This is the medial condyle of the tibia. This is the lateral condyle of the tibia. This is the tibial tuberosity. This is the medial malleolus. The back side. This is the soleal line. The soleal line. Laterally, this is the fibula. This is the fibular head. This is the lateral malleolus. Between my hands are the tarsal bones. The largest of the tarsal bones is the calcaneus. It is undoubtedly the hardest, most dense bone in the body. If you fracture it, you must have had a significant mechanism of injury. Between my fingers, between my hands, these are metatarsals. And again, the toe bones are phalanges, and some anatomists call it the big toe. Good anatomists call it the great toe. Thank you. Hope you enjoyed it.